Good afternoon, everybody, and welcome to another informational seminar brought to you by the Fishtown District. And we're so thrilled to have this dedicated team with us today from the city of Philadelphia to really help us talk about strategies, tools, mechanisms to help deal with those in need or most vulnerable, whether it's community wellness, homelessness. It is a problem and an issue we all face. We all want to do this together so that we're treating everyone with respect. We're making sure that we're not only knowing how we as a team can deal with it, but how we can help others. And I think it is a reflection of our commercial corridor, how we are seen to the outside in dealing with our most vulnerable. So I'm going to stop talking, even though that's rare for me. And I'm going to turn it over to Sam Margolius of the community supervisor from the community wellness unit. And Sam, I want to turn it over to you to introduce your team, and love to hear what you have to say for us.
Great, thank you, Mark, and thanks so much for having me and my coworker Ramon. As Mark said, I'm Sam Margolius. I'm a supervisor with the Community Wellness Engagement Unit for the Department of Behavioral Health and Intellectual Disability Services. We'll share a little bit more about our team and unit, but I'll pass it over to my coworker Ramon to introduce himself. Ramon, you're on mute.
Okay, so good afternoon, everybody. And Mark, thanks for having us as we continue to grow in this relationship that we built and helping the residents in Fishtown. My name is Ramon Cruz. I am the Special Initiative Specialist for the Community Wellness Engagement Unit. And I supervise or oversee teams in Council District 7 and Council District 1. And this presentation is a presentation where we will provide the community with resources. We built this presentation to empower and help and assist our communities with the resources so they can also help themselves. We believe that we cannot do this job ourselves. Empowering and giving information to the community is always great, as strength in numbers is always good in tackling some of the issues, challenges that we're seeing in the city of Philadelphia. So I just believe that this presentation will really help the Fishtown bid.
Thanks, Ramon. And yeah, I'll say, Mark, appreciate you and all the partnership that we've been building over the time. Mark's been, reaching out and gathering any and all resources across the city that he can, and trying to find the resources. And that, as Ramon said, this presentation is really hopefully to share with business associations across the city, with community residents, with neighborhood associations, as much as we can about what services are available and how to get connected with them. So I'll share my screen and we can get started with this presentation. As soon as I shared, it said that my audio was disconnected while sharing. So let me try that again. All right, how about now? Can you see?
I do not see anything, Sam. I'm just getting a buffering Sam Margolius.
I'm getting the same thing. If you want to email the presentation over to us, I can try to share it from my computer if that's easier.
Yeah, let me do that real quick and we can make that happen. Okay. What's your email?
KAE@fishtownbid.org.
Love these Chromebooks. Man. All right. All right, Kay, it should be coming to you any second.
Okay.
Such drama.
The suspense, huh?
That's how we keep a good audience.
This will be an interesting part of the recording.
So while we're waiting for that, could you
Yeah.
explain a little bit about what your unit does, and the role you can play with commercial corridors?
Yeah, absolutely. So we'll once this presentation's up, we can go into a little more detail. But our unit, Community Wellness Engagement Unit, is a team within the Department of Behavioral Health that is community-based, broken out by city council district. And the idea is to have people with lived experience across the city to make sure that businesses, community residents, community organizations are knowledgeable and able to connect with behavioral health care linkages and any other kind of resources that they may need. So our team, as Ramon said, he leads our team in 2 city council districts, in 7 and in 1. That covers South Philly east of Broad, up through Center City, parts of Fishtown, and then also Port Richmond, and goes into Kensington, Fairhill, Frankfurt, Mayfair, Hunting Park, big expansive regions, but we each have teams that are engaging with businesses, with community groups to make sure that people know how to access resources when they need them. So as Mark can share, you know, when challenges have come up in the corridor, you might reach out and ask, how do I connect with the appropriate city service or agency for this situation? And we can try to help bring that resource to bear.
And that's such a great point, because I think a lot of what this seminar will cover is where to go, because I think we all know that there's not one defined response, and each person is in their own different situation. So it's how people and we can respond, for example, without burdening law enforcement when it's really not a call for law enforcement. It's really for professionals like Sam and Ramon to get out there and help. So
yeah, and a lot of these systems aren't the most self-explanatory, and they're not the easiest to navigate. So our team's really here if there's challenges people are having with navigating them. Hopefully we can be a resource. And I'll share, Ramon and I can share our information, contact information in the chat, and be available after today also.
Okay, how are we doing? It looks like you're frozen.
I still didn't get the email, but I hit reply to the chain that we used to set this up. So Sam, maybe you could just reply there and see if that works.
Sure.
Joys of technology.
Okay, I can always edit this part out of the recording.
That a girl.
All right, Kay, back to you. See
All
if
right.
that one goes through.
Let me hit refresh.
Could have gone to your spam.
I got it. Just
There
came
There we go. I promise everyone this is going to be so worth it.
Are we all good?
We're good.
There we go.
All right.
All right, so enough of an intro. We can move on to the next. I think we got the context. So Ramon, I'll kick it over to you to start with this section.
Okay. So as we said, the DBHIDS community resource is from the Philadelphia Department of Behavioral Health, right? And our mission in the Department of Behavioral Health, which is DBHIDS, is to educate, strengthen, and serve individuals and communities so that all Philadelphians can thrive. Our vision is we envision a Philadelphia where every individual can achieve health, well-being, and self-determination. And we do that through a tech lens, addressing trauma, achieving equity, and engaging our communities. So trauma, equity, and community, that's it. And we use the acronym TECH. Our commitment is to addressing trauma, and the lens through which we do all of our work is based on the following framework. Addressing trauma, as I said, transforming operations to be trauma-informed and trauma mitigating, and to reduce traumatic experience in our systems. As we know, our city is going through so much trauma. In the last couple of years, we've been dealing with all types of situations. And achieving equity, transforming systems to reduce behavioral health disparities, promote racial equity amongst our Black, Indigenous, and people of color by intentionally addressing structural and systemic racism. Engaging communities. This is huge as we shift services to become increasingly community-based and to ensure long-term sustained impacts of community. So our tech layers on top of our strategic plan PACE, right? It provides a lens to prioritize focus on transformation initiatives, right? Engaging communities is huge, as when we experienced COVID, after that, most of our stuff went mobile, and we really went out and started being community driven in our department. So how are we doing this? We're blanketing the city with trauma supports through a lot of our programs. We have a network of neighbors expansion, and we'll go into detail on some of these. Engaging Males of Color initiative. This is a 2021 EMOC focus on traumatic of impact on social justice issues in the males of color. Our community wellness engagement unit, it's called CWEU, and that's the unit that me and Sam have been talking about and we are part of. We're designed to provide greater access to behavioral health support, guidance, and linkages to care on a community level, community driven. Again, we have our peer culture and community inclusion unit. And this unit is very, very important in the work that we do, as they have lived experience people engaging in the peer community and integration in those who with lived experience across the continuum. It's very, very important to have people of lived experience in meeting people where we're at. At times, they understand what that person is going through, and they through their experience and their lived experience, they might be able to help the individual with a variety, with empathy, compassion, and understanding, right? Mural arts, we continue to collaborate with mural arts in several initiatives. And then we have our external stakeholder group. And this is a regular meeting where DBHIDS connects with external stakeholders to help inform our trauma-focused efforts citywide. And then we have our faith and spiritual affairs. And I can speak on and on about faith and spiritual affairs as trauma and healing from a faith-based perspective, as we all understand that sometimes our communities, our faith-based churches, and our leaders are gatekeepers in our community.
So this slide and some of these questions actually came from business leaders, business associations around the city when we were forming this presentation. So one question that we got from some business owners was, what types of programs does the department have to engage with the community? And Kay, you can scroll down a little. So Ramon and I mentioned some about our team, the Community Wellness Engagement Unit. Our email's at the top. Feel free to reach out anytime. Ramon and I can share our direct contact information. We're a team that is community-based, made up of people with lived experience who are living in recovery, who've experienced mental health challenges themselves, who have autism, who've supported family members with behavioral health challenges themselves. So we really are made up of people who understand and, like Ramon said, can empathize, be compassionate, and help people navigate and move through into a different stage of goals that they're seeking for themselves. We do our work in a few different ways. One is that we do on-foot outreach in different parts of the city, but we know that's the best way to connect with individuals. We are available to attend community events at any time. If people are interested in hosting community events, we're happy to have a resource table and connect with people there. We attend community meetings, civic associations, business associations like we are here. We're always connecting with providers to hopefully make smooth linkages from whatever the situation is into the provider network. And we can provide trainings and presentations like this one for any stakeholder groups around the city, but also can connect people with mental health first aid training, if that's an interest, with opioid prevention Narcan training, if that's an interest to people. And anytime that something might happen in the neighborhood, we're often one of the teams that's called in to provide community support and connection. Ramon mentioned the Network of Neighbors. This is a program that's been growing in our department. As Ramon said, it used to be called the Network of Neighbors Responding to Violence, but they expanded their focus to really be responding to any overwhelming incident that a community experiences across the city. So that community could be defined however the community sees itself. It could be a community of neighbors on a block. It could be a workplace that's impacted by something that feels overwhelming for that business. So it's a resource here for anyone across the city. One thing that's important to know is that sometimes when traumatic things happen, whether that's violence or a natural disaster or something else, a lot of providers rush in, and the Network of Neighbors really waits for and asks for community to invite them to the table and share what support that they want. So the ask model is here, that they really provide support only when they're invited by the community and the natural leadership of that community is asking for it. So that's part about the Network of Neighbors, and I can't speak highly enough of them, and their numbers at the top there. Here are a few other groups and programs within the department that are important just to know about and mention. Immigrant and Refugee Wellness Academy is here for recent immigrants and refugees if they want to get more information on the department and leadership opportunities that we can support them in. Homeless outreach we'll get into a little bit more, and Ramon mentioned these other ones, so we can keep going, Kay. Ramon also mentioned Faith and Spiritual Affairs. Every year we've got a conference that happens, huge conference, always really successful, brings over hundreds of people across the city together, really to bring faith and spiritual leaders into the conversation around how to reduce stigma around mental health and connect with community. And I will turn it back over to Ramon to talk about some crisis resources.
Thank you, Sam. So crisis resources. What response units are available to call for someone experiencing a behavioral health crisis? So one of the ones that we have, and it's very important, and you see it a lot on TV and on billboards and everything, is the Philadelphia Suicide and Crisis Lifeline. Call or text the 988 to connect with a crisis support 24/7. This can assist with 302 application processes, crisis response center collaboration, suicide-specific calls, mobile team request hubs, information and consultation calls, and mental health crisis. So 988 serves as a universal entry point that no matter where you live in the United States, you can reach a trained crisis counselor. And this is really important. You can, it just, someone with experience, we have been able to utilize this number and giving it to people. I've had a doctor call me that he had someone that he felt was suicidal. I gave the number to the doctor, handed it off, and he gave it to the person. The person called, and very fortunate situation that this person called the number and started feeling better about themselves and came back to the doctor and really thanked them. This is a really important number. Call or text, like I said, 988. It's saving lives. Actually, it's saving lives as we're going through a lot of crisis in our city. So next is our CRC system overview. And this is for the adult system. So crisis response centers operate 24/7, and they offer emergency evaluations to help determine the most appropriate level of care or service, both mental health and substance use crisis. We have several in the city in certain areas. Einstein CRC is at 5501 Old York Road. We have the Pennsylvania CRC, which is in Center City in South Philly, 245 South A Street. And we have the Temple Episcopal CRC, 100 East Lehigh. We also have Friends CRC, which is 4641 Roosevelt Boulevard in the northeast part of Philadelphia. And anticipated opening this year. We have our the Hospital of University of Pennsylvania, Cedar West Philadelphia CRC, which is again anticipated to open at any time this year. I'll hand it back over to Sam.
Thank you, Ramon. One other, so the adult slide we have, just so people know also, 988 can also be called for children in crisis, so people are aware of that too. And I want to say one of the things, so 988 is a national effort that's being pushed out across the country as a new hotline nationally. In Philadelphia, sometimes that might mean that they get connected with a suicide counselor on the phone, or and it might be specific to suicide. In Philadelphia, we've got a pretty robust crisis system. So if you call that number, you can call and ask just for a consultation. You can speak with a counselor right away. They can also dispatch teams. So it's really not just for suicide, but also for any kind of crisis or emotional support. Behavioral health resources. So what's the process for an individual to connect with substance use and mental health treatment in Philadelphia? So CBH member services is available 24/7. The number here is 988-545-2600. Anyone can call that number at any time, and CBH is able to help people schedule appointments, send text reminders, help people navigate to the nearest and best service that's right for them. One thing that's also important to say about this number is sometimes we hear about people who are navigating the system and are experiencing challenges. Maybe they didn't get it, weren't able to access care, or the care that they got wasn't up to the standard that they needed. So people can also call this number 24/7 to file complaints or to share feedback and quality of care concerns. So we also always want people to know that, so that our system can keep improving based on that feedback from people using it. So if you are connected with someone, feel free to use that number in that way too. And there's a how to access treatment guide QR code at the bottom there that has some more information. NAMI operates a warm line, which is connected with our crisis line also, but is really just for people who need to connect with someone, provide some emotional support. It's run by people with lived experience also, people who get it and have been there, and is operated from 9 a.m. to 4 p.m. Throughout the week. If you're connected with someone who might want to speak to someone outside of those hours, I'd recommend that they get in touch with the 988 by texting or calling. Again, I think it's just important that we always talk about feedback and quality of care. So the consumer satisfaction team is again another avenue to report concerns related to the quality of care someone might be getting. The number there on the bottom right, the 215-923-9627, is the number to call if you've got any concerns. But they're really here and are evaluating all the programs that are funded by DBHIDS. They're going out to recovery houses and programs that are funded by the department to make sure that people who are experiencing those services get to have their voices heard. But anyone can call that number to share feedback. We can skip this slide, just mention some of that. I'll turn it back to Ramon.
So, housing resources. What is the process for an individual to connect with housing support resources? And we experienced this a lot. And I know, Mark, you have been dealing with a lot of this. So it's really important to understand we have a DBHIDS Office of Homeless Services. They do extraordinary work. They in this QR code, you'll have information on a flyer that it'll tell you step by step what you can do as you're ready to communicate with homeless services. So for instance, is the crime being committed? So it'll on this flyer, it'll even tell you if it's yes, it'll tell you what's the next step, and no, what's the next step. So if it's a yes, you're calling the 988 for expert help. You're not understanding that this person is experiencing a mental health emergency, right? But if a crime is being committed, you call 911, right? So if it's not that, are you worried about someone who appears homeless or is out on the street when it's very, very cold? If it's a yes, you call Homeless Outreach at their number 215-232-1984, right? And if it's a no, are you experiencing homelessness or need a place to sleep tonight? If it's yes, you visit a homeless access point or get specialized assistance. And the homeless access points are listed on this flyer, which will be Apple Tree Family Care in Cherry Street, Roosevelt Darby Center on Broad Street, and the Veterans Multi-Service Center on North 4th Street, right? So it continues to give you step by step on what you can do. It's a great flyer, a lot of information. I think it's very useful in the work and really giving information to the community on what to do in a situation where you experience a person that is homeless, right? We also have the Stranded Travelers Assistance Program, and this provides assistance to individuals who find themselves stranded. We have found that many people in the Philadelphia area are not from Philadelphia. They are coming from other states. This program actually gets that person back to their city or their state. They get them a Greyhound bus ticket one way to go back, and they have to give them the information where they're going. It has to be a destination. You have to give them a destination site, and they'll get all the ticket ready, and they'll make sure that this person will get to their destination. So, as I said, DBHIDS has a homeless outreach team, and this is a fact sheet. So this is what you would do. The community calls the homeless outreach hotline, and they call this number. It's 24/7, 365 days a year, and this hotline is 215-232-1984. The person receives the details and contacts the appropriate outreach team. And when you're doing this, please, excuse me, give the location of the person, what they may be wearing, because you might have to step off or you might not be around, and now this homeless outreach knows who are they specifically looking for. This team goes out, they engage with the individual in the community. I just want to make sure and continue to express this, that We have to understand that homelessness is not a crime. A person can be engaged, talk to, provide services, and it's up to the person to receive the services or move on. So, our homeless outreach team, it strives to meet the needs of the communities we work in, right? And being coordinated through DBHIDS, teams have specialized access to behavioral health trainings, life support, and intervention. However, there are some things that outreach is not permitted to do. We cannot physically move people. And I express that again, we cannot physically move people. Moving people's belongings or remove any items that may have been left behind. We cannot do that. And we cannot address illegal behavior. All of this would fall under, I would call 911 and get law enforcement involved. What we can do is offer housing options for those who are interested. And again, I express those who are interested. Transport those who are interested to housing, a medical facility, a psychiatric facility, or other resources. We could call in a 302, which is an involuntary psychiatric hospitalization when appropriate. Never give up on an individual and continue to engage them until they are ready, willing to leave the street and connected to necessary supports and services. And I want to say that engaging with individuals, building relationships sometimes takes time, takes a couple of engagements until they've learned how to trust you and believe in you. We don't know what this person has been through, if they've been through the system before or something, or had any type of experience in the shelter system. So we want to be aware of that, and we want to be mindful and empathetic with these things in helping this individual get a better quality of life, right? Go ahead. So go ahead, Sam.
So another question we often get from community groups, from business associations, is what other resources can we take advantage of or benefit from? Like Mark asked at the beginning, so that you all know best how to support members of your community who might need support and resources. So here's a few that we came up with and think are important. So the first is that everyone across the city can get connected with free training on how to reverse an overdose with Narcan. If anyone here is interested in that, we're happy to help make that connection. Mental health first aid is a wonderful free training that individuals can sign up for, or if you're interested in having staff at your business or this group in particular, the Business Improvement District wants a mental health first aid training, that can be organized for private groups or can be registered for on an individual basis. They're happening all the time. And it's a really good way to understand how to identify someone who's experiencing mental health challenges and how to offer some support and connect them to appropriate resources. Youth mental health first aid, similar, but is really for organizations or providers or people who might be working to support young adults and teenagers. We've got an epidemic of teenagers experiencing a lot of mental health challenges. So if you're interested in that, that's also happening all the time and is available for individuals or groups. Healthy Minds Philly is an amazing resource and website. It's just healthymindsphilly.org. If I said earlier that we're happy to come out to community events and be available to connect with community, that's really what we want to do. We want to be where community is. On that website is a way that you can request DBHIDS to be at an event, to have a speaker, to request behavioral health screenings, and has a lot of resources on mental health and well-being. The Network of Neighbors, again, people are interested. That group is really made up of people across the city who want to be neighborhood trauma responders. So if you are interested in doing that yourself, or you're connected with someone who might be interested, you can get connected with their free training to be part of that network across the city. And at the bottom, the Behavioral Health Training Education Network, BH10, has a lot of free and low-cost trainings that anyone can register for on their website. What can you do to support individuals experiencing homelessness or behavioral health crises? So we shared a bunch of resources. It's important to just remember that we're all part of the same community. That's why we're here doing this presentation, to make sure everyone knows how to access support, so we can all be a resource to other people in our neighborhood. Register for some of these trainings, tell your peers, tell your networks to do the same, and share information on resources like we've shared today. And at the bottom here, there's two great go-to resources that we share that have access to information on access to food security resources, medical care, housing support, utility assistance, all sorts of great things in these two resource guides at the bottom. During COVID, the department came up with this Boost Your Mood campaign and website. So also there's great resources and wellness tips here on Boost Your Mood, healthymindsphilly.org/boost. And we're happy to talk through any questions. Again, Ramon and I are happy to be a resource as you're helping anyone navigate these systems. And if you can, this is a new presentation. We always want to make sure it's useful. So please, click on the link, take the QR code, and share some feedback so we can make improvements too. And thank you. Appreciate it. Appreciate the opportunity to be with you all.
Thanks, Sam. Thanks, Ramon. And one of the things, and I think, by the way, great presentation. I think it's always important for all of us in the community to be aware of what can and cannot occur. And Ramon, you hit on a lot of those things when you're dealing with people who may be affected by homelessness. The procedure has not and is not, okay, we're going to come swoop them up. The goal is always to go evaluate, and certainly Ramon, Sam, correct me if I'm wrong, evaluate and then offer. See what we could do to help, see what's going on, because there's so many different factors that go into this. It's never a square peg and a square hole. Oftentimes it's often a lot of different things. And certainly I hear you have all been so responsive in doing that. How do you approach maybe someone where they may need help, they refuse it? Do you keep going back to check on them? What is the best way for us to handle someone like that? Is maybe it looks like maybe they're homeless, they're setting up somewhere, behavior may be a concern, but they're not taking the initial services you're providing.
It's a great question. Kate, could you scroll back up to the homeless outreach fact sheet? And Ramon touched on, yeah, that's beautiful right there. So it's a few things, and it's helpful to talk through the examples, Mark. It's often the case that people don't want to come in to shelter, right, when we engage them. And so part of what I think is the answer is just a lot of this work is long-term relationship building. Oftentimes when people call the homeless outreach hotline about an individual, it's important to remember that the team probably already is connected with that individual. Maybe they might have been in a different location and they've gotten moved from one block to another. So it's always helpful to call. And if you can share information about the individual, you can dispatch a team. But it's also just important to know that you can do that to just alert someone, to alert the system that someone's there. Because after they get alerted, they can add that individual onto their focus list to continue going to that neighborhood or continue going to follow up with that person and try to do that long-term relationship building, work on a housing plan, get them in the system. There's a lot of housing options out there. And sometimes it's about finding the right housing match and building the trust over time to make that connection. Sometimes it gets complicated when people keep getting moved from one place to another, and the team that might be doing that relationship building gets interrupted, right? Or they have that experience with the person getting their stuff getting moved and trust gets lost or challenged, I'll say. Does that, and Ramona, add anything if I'm missing something?
Yeah, I want to add, and that's great, and a great question again. as we all go through this and we all learn from this, right? I also want to humanize that situation, right? Because at the end of the day, let's understand, right, that that's somebody's loved one that is going through a situation, a crisis situation. How would you want someone to treat your loved one? So I always want to humanize that situation because I think sometimes we that gets lost in a situation like this, and we don't know what trauma this person has been through or is going through. So understanding, active listening, and one of the trainings that we have is the mental health first aid, which helps you recognize some of these things and how to deal with that. I think that training is such a great training and something that is offered to the community, and I think I highly recommend it. But we need to understand how to humanize the situation, right? Listen. I am a person who is in recovery from mental health challenges. That could be me. But through the grace of God and someone helping me and me going into my recovery, I am able to be on this side helping, right? So we have to understand that. And again, how would you want someone to treat your loved one if that person is going? Would you want someone to talk to them any other way, treat them very terribly? How would you want that person to be treated if it's your loved one? So I try to do that all the time. I try to talk to people about that all the time. But sometimes we need to humanize the situation, right? So again, that training is very, very vital to really learning about mental health first aid and what people are going through, right? So Mark, again, just really trying to help listening, active listening to the person, and really trying to get them to know that you care. I know that helps. When someone cares and you're listening, that person is willing to maybe trust you a little bit, right? But we live in a world of instant gratification, air fryers, microwave. We want things to happen fast, right? And we have to understand that, it's a process. They didn't get there in one day. It was a trauma that was built, and they're really dealing with it. And maybe they're not dealing with it, and they're going through some things. So really trying to humanize the situation, Mark. I hope that helps.
No, it doesn't. It actually leads to a question you may or may not have an answer or a general procedure about. Certainly as you know, we have our safety ambassadors here that go around. They've gone with Ramon, you and your team, and they're really very positive in how they deal with the people in this situation. People need help. Is there a recommendation? One of the things about our businesses, especially our food places here, they want to help, give food, things of that nature. Do you recommend that people do that, or is there a procedure you'd recommend businesses to follow to do? And if there isn't, that's okay.
Sam, you want to answer that, please?
Yeah, I mean, there isn't one, to answer quickly. There isn't one that we have guidance for businesses in that way. I know that different businesses, make a point of sharing food at the end of the day, or might have a practice of doing, but we don't have a guidance as a department for businesses on that.
Understood. Kay, do you have anything?
I just wanted to add one quick thing. I appreciate, Ramon, you adding that on the last question, and just emphasizing again that this team, the outreach team, is amazing, and they never give up on engaging with someone. It's like the next slide will never stop coming out. So please always call, even if there's a small encampment forming and you want to just make sure that homeless outreach is aware of that location. You can always call this number so that it's on their radar.
And I second that. Ramon's team does an excellent job of not just being responsive, but being caring, attentive, and really trying to help everybody. The person, because it's a community issue. So Ramon, thank you. We really appreciate all that you do. Any questions, folks? I don't want to dominate the whole time. Okay, we'll go to you first, and then we'll go from there.
Okay. Less of a question, more of a plug. I just wanted to echo Ramon's the mental health first aid training. I went through it myself. I found it extremely helpful, not only for being able to recognize mental health crisis and being able to adapt to it, but also to maintain my safety at the same time. I thought that the training balanced the ideas of wanting to provide services and be helpful for the person that is experiencing crisis, while also, you know, keeping in mind your safety and your comfortability as a you know, regular person, you know, whatever that means. But I thought that that was a really, really helpful training. So I appreciate you guys bringing that up, and I just wanted to echo that for any of our businesses that might be interested, that it is a really worthwhile training. And Nima, I saw you had a question. So
Yes, I saw Nima, you're up.
Yeah. Yeah, I guess my question is about, so we've been calling Project Home because we didn't have all these other resources when folks seem to need help and they're willing to receive it. That has worked well for some folks, but we do sometimes have people who come in who I assume to be homeless, I'm not sure, but who are like, there's one gentleman in particular who comes to mind who's like pretty disruptive with our customers. He's very you know, we really try to treat him with kindness and compassion, but he does not receive that well. And you know, I am somewhat at a loss for what, like, typically when he's come in, I've been there, so I've handled the interaction myself. It's still been pretty uncomfortable, you know, and we're kind of on the verge of opening later than we have before. And I know I have some staff that are concerned about just like their own safety at night, just because they're not used to working so late. And I sort of struggle to have a great resource to connect them with if they do have a more acute kind of pressing issue that comes up, because we'd rather not call the police. Like, we understand that that's not helpful in most circumstances.
Yeah.
Before Sam and Ramon go, one of the, so Nima, and I'll give you the name and number. Our ambassadors are always, they're out. I can give you the number to call. His name is Scott. It's 215-688-6069. Again, that's 215-688-6069. And he'll make sure that, you know, our team is traveling too, they'll come over. They're trained in all of the necessary de-escalation techniques, and then they know who to call based on what they observe. But what their job is to basically make sure that they de-escalate the situation in your store, get the person out of it safely, and then hopefully get the person the services they need. So please use that anytime. Ramon, Sam, anything else you could advise for Nima in this type of situation?
I mean, you've brought that local resource to bear with the with Scott's team and the local ambassadors. I would say, Nima, the hesitance to call 911, you know, the question that we talked about earlier with crisis, the original question was like, what non-law enforcement crisis response units are out there and exist? So 988 is always a resource. They can dispatch teams for mental health related crisis. But if there's threatening behaviors and there's or any like concerns for safety, I would also just say, if it does feel appropriate to call 911, you can also request a CIT trained team to come out, and that will be officers who've been trained particularly in mental health and crisis related response. Ramon, you can talk more about it. Ramon's one of their trainers for that unit. And then also they have a team, the CIRT team, CERT, that is a co-responder model where police would come out with a social worker, with a behavioral health provider, to be able to respond with law enforcement present. So it's important to know that that is a partially a law enforcement response, but they'd have social workers on hand also.
Yeah, Sam, and that is definitely what you should do. But again, and Nima, your concern is also your patrons, right? Your business and everything. You want to make sure that they're safe also, right? So please do not be hesitant to call law enforcement. Use the 911-988 number. They get a CERT team out there. Mark, you made the great suggestion with Scott. Scott and them are great. I did a walkthrough with them. I've been in the Fishtown area and seen them. I think they're great, but they could also use some help and some assistance. I always say strength in numbers. And again, you're protecting your patrons. So please do not be hesitant. If that person is causing havoc and could be might hurt someone or hurt themselves, you need to call 911 or 988 and ask for a CERT team. Ask for a CERT team. They're a crisis response team, and that's what they do. I do a lot of their trainings in the CIT, crisis intervention training. These officers are well experienced, well trained to really interact, engage, and help individuals in crisis. So please, don't be hesitant to use that number or call. You are really doing a service to not only your patrons, but that individual also. And safety is paramount in this.
Thank you so much. Appreciate it.
Thank you, guys. Anything further as we get close to the hour mark? Hearing none. Sam, Ramon, I want to thank you certainly for your time today, for the information, insight. Just for everyone to know, this video and the slideshow will be in our newsletter this Friday, our email newsletter, as well as we'll post on social media. But more importantly, I want to thank Sam and Ramon for just their great work, their attentiveness, their responsiveness, for every positive adjective I can give. I mean, we have really made it a point here in the district to make sure we're partnering with the right people and right agencies to help everybody. And Sam and Ramon have stepped up from the very beginning and really, really provided a lot of help. So thank you, guys. We really appreciate you.
Likewise. Thanks, Mark.
Likewise.
And with that, it's a beautiful sunny day. Everybody go enjoy and have a great day.
Take care, everybody.
All right. Take care.
All right. Thanks again.